All right, good afternoon, everyone. It's Dr. Dan Ritchie, president of the Functional Aging Institute, and today, back by popular demand, is Dr. Emily Splickle from the Evidence-Based Fitness Academy in Naboso. And they are elite sponsors of the Functional Aging Summit 2023. That will be June 15, 16, and 17 in Salt Lake City. If you have not bought your early bird ticket yet, I am warning people this year, Dr. Emily, we anticipate it's going to sell out. I've probably been saying that for several years, so people don't believe me, but I'm not crying wolf this time. I do think it's going to sell out based on the venue, and also based on our new relationship with ISSA. I believe they will drive ticket sales, so we will probably wind up selling out at about 300 tickets this year. So don't delay on purchasing your ticket. You'll get to see Emily there live and in person. I'm going to turn it over to you, Emily. I'll be here. If somebody asks a question, I think I should stop and interrupt you because several people are like, what is that term she just dropped on us? Just so everyone knows, I am recording it. We will send out the replay link probably in about 2 hours. So if you have to leave early, you will get the replay link in your email regardless. So Emily, please take it away.
Awesome. Thank you, Dan. Thank you to everyone for joining me, either live or if you're listening to the recording. As Dan had said, or maybe some of you are familiar with me, but I am Dr. Emily Splickle. I'm going to go forward real quick, just introduce my slide, and then I'm going to go back and introduce the topic. My background, functional podiatrist, human movement specialist. I've been in fitness for over 22 years. Founder of EBFA Global, and FAI actually sells several of our courses. So make sure if you are part of the FAI network that you check out some of our courses through their platform. And then you can also look at ebfaglobal.com. We have our Barefoot Training Specialist, which is our foundational course. I am going to be exploring that aspect today because we're talking about foot assessments. And if you have not checked out my book, Barefoot Strong, super fun, easy read. It's a great stocking stuffer. So if you're looking for that last minute gift, check that out. And then of course, Naboso. Follow me on Instagram. Okay, so what we're going to be talking about today is going to be an intro to foot assessments. Partly that beginner guide or intro is because we've only got about 45 minutes, but it is also to introduce that at the Functional Aging Summit next year, which Dan had mentioned is happening in Salt Lake City, I will be doing a pre-con where we're going to be doing a deeper dive into foot assessments. So you could think of this as either something to be a introduction and to pique that curiosity for that pre-con, or you could see it as something to pique your curiosity and then look at some of the courses through EBFA Global. And as I had mentioned, FAI sells some of our courses as well. So I am introducing the idea of the biomechanics of the foot. I love to talk about sensory function of the foot, but today we're switching gears and we are going into the mechanical side of the foot. What does that mean? How do we do a very basic assessment? And then how can we start to build stability or strength in that individual? So what we're going to do, bigger picture, is think of our foot as our body's foundation. It's our body's mechanical foundation. And just like the foundation of a home or a building, if your foundation is not stable in a home, that home is obviously not going to be stable. It's going to start to kind of collapse on the walls. Similarly, if our feet posturally, so our foot posture is not stable, or sufficiently stabilized during dynamic movement, then that can have an effect further up the chain. One of the easiest examples would say that perhaps if someone has a flat foot, we're quoting that because again, we have to go into what does that even mean, but a flat foot, they may complain of knee pain. They may complain of back pain. Very common mechanical association between knee stress, back stress, and overpronation or flat feet. So that's just an example of this foot foundation, and our foot posture affects all the joints above it from a postural perspective. Now, when I introduce foot mechanics in our barefoot training specialist certification and a majority of our courses, I like to break the foot down into 3 main sections. So we have rear foot, we have midfoot, and we have forefoot. I'm going to very rapidly step to the side because I'm grabbing my skeleton. Hold there one moment. Yes, I'm back. Here we go. Now I have my foot skeleton to show you this. Okay, so when we're looking at that foot, rear foot, midfoot, forefoot, obviously the rear foot, this is our beginner's guide. That is where we're going to start. And the rear foot is going to be composed of 2 joints. So you are going to have your ankle joint and your subtalar joint. Sometimes people will call your ankle joint your talocrural joint. For simplicity and for our client's perspective, they are going to really understand that as ankle joint. So your ankle joint, your subtalar joint. Okay, so we have 2 joints. Now it's important to think about ankle joint and subtalar joint together are actually considered a complex. We don't go into this in this webinar, but in the pre-conference at FAS and in the BTS certification, we go into triplanar motion of the complex, pronation, supination, triplanar between these 2 joints. Today, simple, basic beginner guide. So let's start by thinking about our ankle joint. Okay, in our ankle joint is formed by our tibia, fibula, and talus. So tibia, fibula, talus makes up your ankle joint. And the movements of that ankle joint is dorsiflexion and plantar flexion, right? So we dorsiflex and we plantar flex. We dorsiflex when we squat, we plantar flex when we push off and take a step. We plantar flex when we hop, we dorsiflex when we land from a jump. So that movement, that's kind of coupling or that dance back and forth between dorsiflexion and plantar flexion is part of how we load energy and how we release energy. So when we dorsiflex the ankle, we are actually loading energy. Okay. When we plantar flex our ankle, we are releasing energy. Everything that I talk about with the foot and the ankle, you always want to put a functional component or reasoning behind it. Okay. Versus just straight memorization. We always want to have that logical application. Okay, so ankle joint, tibia, fibula, talus, dorsiflexion, plantar flexion. Dorsiflexion is the action of absorbing energy. Plantar flexion is the action of releasing energy. Okay, now as we go through the assessment to properly squat and walk and move through our ankle joint, we need a certain amount of dorsiflexion in that joint. And that's actually where most people are restricted. So there's not a lot of attention around plantar flexion. Today, we're not going to talk anything else about plantar flexion because first layer, we want to master our understanding of dorsiflexion. Okay, so when we walk, when we squat, we are looking at the way that someone is moving through their ankle joint. When we walk, you need to have at least 5 degrees dorsiflexion in your ankle. Okay, now that would be something that initially I would just write down, right? 5 degrees dorsiflexion ankle. That's what we're looking for. Okay, now to understand the compensations that we see is simply based around this understanding of the way that we move through joints is based off of your body taking the path of least resistance. So if I walk and I'm rolling through my ankle, if I do not have enough dorsiflexion, I don't have 5 degrees dorsiflexion, I have to take the path of least resistance, which means instead of moving through my joint, I go around my joint, which you can see on this squatting pattern right here. Do we see how this gentleman is squatting? Right here, this right foot where my arrow is, he's essentially going through his ankle, no range of motion, so I'm going to go around the ankle joint. Now, essentially what he's doing is pronating, right? And we'll go just a little bit into the subtalar joint and what that means. But this compensation or this going around the joint essentially unlocked and destabilized his entire lower extremity. So from stability and power, we are looking at optimal range of motion so that when we squat, walk, jump, we are moving through our joints, not around our joints. Okay. Any compensation of going around a joint versus through a joint typically unlocks or destabilizes that joint and the surrounding joints, which can cause transfer stress. So from a basic foot assessment, a squat assessment, what you want to do is as you look at your clients squatting, you want to refer to where the creases are in their ankle. So it's a little bit hard to tell, but could you see that there's creases on the front of the ankle joint in the picture on the left? Okay. So what I'm saying, just through looking at his ankle, he is going through the ankle joint. The creases are directly on the anterior aspect of that ankle joint. I love it. It's good alignment. I'm happy. Beautiful. Over here on the right, unfortunately, as he's going through his ankle joint, he hits some resistance. So he takes the path of least resistance. He unlocks and collapses that foot. So if I were to look at the creases around his ankle joint, could you see that they're kind of on the outside here? They're around what's called the lateral gutter. So he has creases right here as he's squatting through his ankle or around his ankle. And what that is showing is that he's not going through his joint, he's going around the joint, and technically he's collapsing in this transverse plane. So he abducted his foot and collapsed, which is just further representing this lack of stability, okay? Obviously, you could go further up and say, oh, look at his knees. The knees are not in line with the foot, which means there's a valgus moment to the knees. All of that, totally appreciated. But just right now, let's just start by thinking about ankle joint in isolation. What is happening? Are the creases of the ankle in the front? Does he have 5 degrees? Or actually, when you squat, you're obviously going to get a little bit more of that range of motion. And is he keeping the rest of that foot in neutral? Okay, little sprinkle, little introduction to the ankle joint. Let's go to the joint below it. So the joint below your ankle is going to be formed by your talus and your calcaneus. So this is going to be your subtalar joint. I'm going to talk a lot about this joint because this joint is so interconnected with your leg, your ankle, your forefoot, all the way into your big toe. So your subtalar joint is typically assessed from behind. So the movements of the subtalar joint are going to be assessed from behind. This is a part that I'm actually going to have you move a little bit with me. So if you guys don't mind standing up and joining me as we move our subtalar joint, and we're going to start by standing with our feet shoulder width apart. And as we stand with our feet shoulder width apart, I want you to look at the pictures on the screen and go to the outside of your feet, just like the picture on the left. And then let's go to the inside of the foot, like the image to the right, and then go back and forth from the outside to the inside. Outside, inside. For the sake of right now, what we're talking about, we're going to say that we are isolating out our subtalar joint. I know that's not possible, but just humor me here. Okay. Inside, outside, inside, outside. So we are moving our subtalar joint in the frontal plane. Okay. Now that frontal plane movement, we could see here, if we stop on the outside of our feet and you look down, this is referred to as subtalar joint inversion. You could also say, if you look over here on the left, that is an inverted foot. Or you could say if we were walking and there was a moment in time that our foot looked like this, we would be inverting, right? So we are inverted, this is inversion, or we are inverting. So just know that there is always that dynamic nature to your foot. Similarly, if you go to the inside of your feet, you are everted, you're everting, or you have an everted foot, okay? So we want to, again, understand how to use these terms. So you could say that's an everted subtalar joint, okay? Now, similarly, instead of just memorizing and saying, that's an inverted foot, that's an everted foot, right? We want to understand what they mean. So I'm going to sit for just a moment, but don't worry, we're going to stand up again soon. We want to know what it means, okay? This is the functional application of the mechanical position of the foot. So when your foot is inverted, inverting, or in inversion, all synonymous, right? Just used slightly differently. It means that your foot is in a position of stability. It is locked. It is rigid. It is unloading energy. It is a power position. Okay, so those are the adjectives and the characteristics that I want you to associate it with that foot position or with that foot movement. Similarly, on the other side, when your foot is everted or everting, right, it is technically considered unlocked, unstable, hypermobile, decelerating. It is a moment of absorbing energy. Okay, so obviously, as we go through each step, you are essentially dancing back and forth between inversion and inversion, eversion, inversion, right? I have to unlock to absorb energy. I have to relock to stabilize and release that energy. Oop, now I strike the ground again, unlock, restabilize, push off, strike the ground, unlock, relock, push off. And you do this 5, 10, 20,000 times a day. Right? So that understanding is very important. This means that if I look at my clients standing and perhaps I see them statically looking like the picture on the left, and they say, oh, I keep getting stress fractures. I have Achilles tendinitis. I have IT band issues. I'm not going to be surprised at all because they are overly rigid. Their foundation is too stable, too rigid, right? So could I bring a little bit of mobility and relaxation to that foot? That would be my goal. Okay. And then on the other side, if your client was standing with an overpronated, again, we'll go into what that means in the pre-con or in the other courses, but in this unstable, unlocked position, and they said, oh, every time I run, I get knee pain. Oh, I have shin splints. Oh, my low back hurts, or I have piriformis syndrome or SI joint pain. Again, I'm not surprised because their foundation, their entire foundation is an unlocked, stable position. Okay, so we want to bring some meaning to that. All right, now it's time to stand up again because we want to be able to take this foot understanding, this foot assessment, and apply it to the bigger picture, meaning the rest of the body and how it is relating to the other joints or to the total dynamic movement. So let's stand up again. Here we go. Okay. We're back to our feet shoulder width apart. We're going to go back and forth to our subtalar joint movement. So we are on the outside of the foot, then the inside, outside, inside, invert, evert, right? Lock, unlock, lock, unlock. Now, every time we do this, what's happening to our knees and to our lower leg? Oh, I see rotate in, rotate out, rotate in, rotate out, right? So let's go into eversion, eversion, picture on the right. What position are your knees in? My knees are valgus, right? They're coming in. What rotation is happening to my lower leg, my tibia? Every time I evert, my tibia is rotating in, right? And then my knees go into a valgus. Every time I go into an inversion, so let's do the opposite, my tibia is externally rotating. So what we can start to see, this is actually called joint coupling. So joint coupling means that subtalar joint inversion is coupled with tibial external rotation, and then opposite, subtalar joint eversion is coupled with tibial internal rotation. So let's just take another step back. Let's think about just tibial or lower extremity rotations. You got internal, you got external. Both internal and external rotation are transverse plane movements, okay? Now, just like we spoke about the feet, right? We absorb energy in one way, we release energy in another way. How would you match that with the rotations, right? Through which tibial rotation do we absorb energy? You could say lower extremity as well, right? What rotational moment allows us to absorb energy? And then opposite, what rotational moment allows us to release energy, right? Is associated with a position of power. Think about sprinting, jumping, right? What muscles do we ultimately want to activate in our hips to get power when we are jumping or sprinting? I hope that at home you're saying, oh, we load energy through internal rotation, right? And we release energy and power through external rotation, because guess what your glutes do in the transverse plane? They are very strong external rotators, right? So the couple, again, we went to the couple, but I want you to understand the application of the couple. Subtalar joint inversion, rigid, stable, locked. What rotation is that coupled with? External rotation, rigid, power, locked. Yes, perfect. And then let's go to the ankle. What position of your ankle is associated with power and stable and acceleration? Plantar flexion. Yes. So guess what? You put them together. And that is how you can take interconnected triplanar biomechanics of the foot to the next level. Let's do the same thing with the other one. Eversion is unlocked and absorbing, it's decelerating. This is coupled with internal rotation is a moment of absorbing energy and unlocking, right? Which movement of the ankle allows you to decelerate and absorb energy? Dorsiflexion, right? So dorsiflexion, internal rotation, eversion, they all play together to allow your foot and ankle complex to absorb energy. So those couples, very important to understand the mechanics of your foot and ankle complex, specifically to the rear foot. Okay, hope it's starting to make sense. Okay, love it. So let's go into how we would start doing an assessment. Okay. And if anything that I'm going into and saying, you're kind of like, whoa, she is talking Greek right now. Don't worry. Listen to the recording. Listen to it again, right? Take the pre-con, take the course. So let's go into how you can start to do a basic closed chain assessment. Now, why I like a closed chain assessment is because, one, you don't need to touch the client, which means you could do it virtually, depending on scope, right? Some people say, whoop, can't touch the client, right? No problem, not touching them. I'm just looking from a distance, right? And you're having them move and then determining certain associations based off of what you're observing, right? The ability to perfect a closed chain assessment of the feet and technically the whole body and a gait assessment. I would love to do a webinar on gait assessment, intro to gait assessment, is that you can do these things even in a virtual environment with your clients, which is super, super powerful. So here we go. What you're going to do is you're going to take your clients through 3 different steps. They're going to start with their feet shoulder width apart. They're going to go into a single leg stance, and then they're going to do a single heel raise. So again, double leg, bilateral stance, relaxed, go into a single leg. Yes, this is a balance assessment, but we're going to talk a little bit more. And then 3, they're going to go into a single heel raise. So we are starting feet parallel, heel directly behind the toes. Now, you can kind of stand. I'm going to move. I'm just a very moving type presenter. So when they're standing here, if they stand in a relaxed position, then oftentimes people will stand with their feet turned out, right? Standing kind of like a duck. We'll say, no, I need you, even if it feels like you're turned in, no problem. That's part of I'm just gathering information. Heels directly behind your toes. You're going to have your hands by your side and you're looking straight ahead. I cannot have you looking at your feet while I'm looking at your feet, because technically when you bring your chin to your chest and you look down, you are changing your foot position. Okay, so head is up, nice and relaxed, arms are by your side. This is considered a relaxed calcaneal position. This is the position that the client would be in, theoretically, let's say if they were a bank teller, or worked in a grocery store, or a personal trainer, and they're standing watching their clients. Many people stand, you have a standing desk, right? Many people stand in this bilateral relaxed calcaneal position. The emphasis here is on relaxed because this is important. If a majority of your day is spent kind of in this relaxed position, I need to understand what is your baseline foot posture as far as how it's going to affect the rest of the body in gravity. Okay. Do I see inversion? Do I see eversion? Or do I see that calcaneus neutral? So you could follow, this is your Achilles tendon coming down towards its insertion, and then you're looking, do I have a little bit of concavity here? If I have a little bit of concavity, that's going to be some subtalar joint eversion. If I look and I see a little bit of concavity on the inside, that's obviously going to be a little bit of subtalar joint inversion. Remember, that creates rigidity. Or is it vertical? Okay. Now, if you were to choose one between more inverted or a little bit everted, a little bit inverted or a little bit everted, if you had to choose one, you always want to be slightly everted. In podiatry, it's going to sound weird, but it's just a thing, is thou shalt not varus. Again, there's these weird things you learn in school, but I just remember it was the one thing that was always taught during all of our biomechanical training, that if I were to do a reconstructive surgery on a patient, or when I correct someone with an orthotic, neutral is obviously vertical or just a few degrees unlocked. You never want to get someone into a few degrees of varus relaxed or statically, okay? And that's that thou shalt not varus, okay? So varus, the inversion. So if you see a little bit, right? So on this client here, there's a little bit of eversion, little bit, boo, totally fine. I'm not excited at all. I'm not going to push them into orthotics. It's okay. We're good. Okay. So we don't want to see a little bit and then just be like, oh my God, they are totally pronating and have flat feet. Okay. So small amount of valgus, A-okay, we're good. Okay. You're then going to go into a single leg stance. Now, the emphasis of the single leg stance is that what happens when you go from 2 legs to 1 leg is that your glutes should be engaging. Right? That is the big emphasis around single leg stance, is that we have glute activation in any sort of single leg stance position, or you should, right? Single leg stability, that lateral line, you're obviously getting into the glutes. Now, if I see in a bilateral relaxed stance, I've got some decent eversion, right? So I've got some instability in this relaxed position. I'm getting a little bit concerned, right? So I'm going to have them go into their single leg active position. Now, if their glutes are strong, they should be able to pull that slightly everted foot into neutral. Okay. So that's what I'm doing. I'm going to stare at that right foot. I'm going to stare at that right foot and say, stand on one leg, stand on one leg. Boom. She corrected it. Love it. Right? That meant that her glutes engaged, talked all the way down to the foot stabilizers, and we good foot to core lateral line stability in this client. Super happy. Okay. Now, on the other hand, let's say you see some eversion in the foot here. You're looking at that foot. It's unlocked. I'm getting a little bit concerned, right? But my assessment is not complete because I need to see what happens as this client goes into a single leg stance, and can they create stability in an active position. I'm staring at the right foot. I'm staring at the right foot, staring at the right foot. Let's say we go to the right foot and it's boom, it stays everted. Oh my goodness, right? It is unlocked when they're supposed to be active. That means their glutes are not sufficiently stabilizing that lateral line and that foot to core connection. I'm concerned now, right? I'm concerned. Okay. Now, what does this mean? This means that I need to teach them how to strengthen their intrinsics, their posterior tibialis, their foot to core connection, and by golly, their glute stabilizer, so they can externally rotate into a neutral foot position. Okay. So that's one of the biggest takeaways that you can see is what happens in your clients going from a relaxed position into an active position. The active position, which is a single leg stance, is mimicking what happens to their foot to core, hip as they go through mid stance. So every time I walk and I'm swinging my leg through, standing on one leg, if I don't have stability statically between my glute and my foot, I'm sorry, friends, there's no way in bleep that you're going to have that dynamically, right? And then if I see that statically on a runner, I know for sure if I used a high-speed camera that I saw them running, that foot would be totally collapsing. They probably have valgus in their knee, and they most certainly have delayed glute activation. Okay, so we're just starting to connect, right? What do these things mean? We're trying to find associations, okay? Now, your third piece to that is going to be a single heel raise. Now, what happens in a single heel raise is this is the moment of re-stabilizing the foot, okay? Re-supinating is technically what it is, but you are inverting it, okay? So as we go onto a heel raise, we are now taking a step. We're going up the stairs. We're doing a jump, which means we are in a position of acceleration or releasing power and energy, which if we go back to the subtalar joint and the tibial rotation and the ankle, we should be seeing plantar flexion of the ankle, external rotation of the tibia, and inversion of the subtalar joint. If I don't see that inversion of the subtalar joint when someone does a single heel raise, they're not stable enough. They're not stable. Will they be able to walk? Sure. Your body finds a way to do everything, but are they maximally optimizing energy release and acceleration and power? No, because in order to do that, you have to be sufficiently locked in the rear foot. Okay, so what you're looking at initially, beginner's guide to foot assessment, is that as I go into a single heel raise, we're going to look for inversion of the subtalar joint of that heel. So I would essentially be using a pen and I would put it on the heel bone. Let's say this is my patient. I'm going to put it on the heel bone like this to see that it's sitting oblique or inverted. Okay. So we'll just say, okay, we got that. Good. All right. So let's go back here. So the way that you will actually do this is I will have the client stand here. They're not touching a wall. Maybe the hands are by a table. So I'm next to a table here. But for now, my hands are by my side, totally relaxed. Okay, I'm doing my assessment. Is it inverted, everted, neutral? Okay, now Emily, shift to your right leg. I'm standing on just my right leg. One, I'm doing a balance assessment. So I have them stand on that one leg for 10 seconds. They're looking straight ahead. Stay on one leg 10 seconds. If you wobble or you put your foot down, okay, I also know I need to do some balance training with you, right? So I'm here doing my 10 seconds. Hands go onto the table or the wall. Do not lean into it. It's just for balance. It's a light touch. And then slightly bend your knee. Lift your right heel, please. When I lift my right heel, I'm looking for that inversion of the heel or the subtalar joint. And then I come back down again. Stand on both feet. Hands are by your side. You're looking straight ahead, totally relaxed. Now I'm looking at both feet again, focusing on that left side. Shift to your left leg, Emily. Okay, I'm standing here for 10 seconds. Good, good. I'm doing a balance assessment. I'm looking at that subtalar joint. Are the glutes engaged? Assess. Hands go on the table or the wall, just lightly touching, slight bend in the knee. Lift that left heel as high as you can. Do I see inversion? Come down, beautiful, both feet by your side. Okay. Now, that is how you are starting, and you want to flow through those 3 steps of a basic foot assessment. Okay? Have it flow, feet are parallel. You're adding in a balance assessment in there, which is awesome. On the single heel raise, you're actually adding in a post-tib muscle test. So a posterior tibialis muscle test, huge. Right? We're not going to talk about that today. That will be happening in the course. Okay. Now, let's just go a little bit into what we see here. Okay. What we see, how we can start to process this information. Right? So when I look at the foot, now you could see that I did say to start looking at the foot from behind, but there's no problem. I don't do a formal complete assessment from the front. But if I look at that picture on the left, so I'm looking here at the woman with the jeans on, right? And I'm looking, she's taking it in. She's relaxed, bilateral stance, head is looking straight ahead. Little bit concerned of this unlocked position here, right? If she's complaining about plantar fasciitis or arch pain, not surprised, right? Not surprised. She's unlocked, right? Now, the other thing that jumps out at me is that as I'm looking at her, don't her feet look a little bit asymmetrical? That right foot looks more unlocked than the left. I wonder why that is, right? Okay. Now, what happens is when we unlock our foot through eversion or technically pronation, but we get this collapse, this unlocking of the foot, like we see in the woman on the left, is it actually shortens your leg length. So when I see an asymmetrical eversion or unlocking of feet, right away my mind goes towards a potential limb length discrepancy, right? What is that going to do all the way into the pelvis? If that woman on the left, her right side, and she had a obliquity at her right pelvis, I'm not surprised, right? Because what happens when we unlock our feet? Let's stand up and feel that, right? I'll have my hands on my hips. My hands are on my ASIS right now. I'm standing here. Let's evert both feet, right? Did you feel that? My pelvis went like this, right? Evert again, my pelvis went like this, okay? So what happens if I keep my fingers on my ASIS and I'm going to do just that eversion on my right foot? What happens? Wait a minute. Now my pelvis is not symmetrical, right? So if I have one foot that is more unlocked than the other foot, well, now I have what's called obliquity in the pelvis. That can start to affect so many other things in the rest of the body, right? This is why your feet posturally is your body's foundation for the rest of your skeletal alignment, right? So I would want to see what happens. And I know that when this woman on the right stands on one foot, there is no way her glutes are going to be able to correct that foot, right? We could go into a topic of orthotics and how could we use shoes and things like that. Could I teach her to find neutral? Absolutely. Absolutely. If she's standing at her standing desk like that, or doing dishes or brushing her teeth like that, I would say, you know what, Jane, we'll just call her. When you stand with your feet shoulder width apart and you're brushing your teeth, or you're doing your standing desk, I need you to find your foot tripod and then externally rotate into your hips and then lift your pelvic floor, keep your digits on the floor, and you just set your base, right? Now, Jane, that is how I want you to hold your feet when you are at your standing desk or brushing your teeth, right? So I'm teaching the client to find neutral despite having this foot posture, okay? Now let's go to the right. What I see here, this right foot, that's beautiful. That's beautiful. That's what you would want to see, right? I like it. I really do, right? When I look back here, I see the pinky toe. That's it. You don't want to see too many toes. Pinky toe, awesome, good. Side of the first on the inside, great. Okay. We're looking over here, and I know the perspective is a little bit kind of skewed because of the camera shot, right? And how that patient is standing. But can you see this bulge? What is that bump, right? What is that bump? That bump is the navicular bone right here. Okay, so she's collapsing. This is just a behind perspective of kind of what's happening over here in the right foot. So she has this unlocked prominence to her middle foot that is unlocking her rear foot. Okay, that topic and conversation is definitely going to be covered in the pre-con. Right? So my goal is to get that pre-con filled, right? It's going to be great learning all of these different foot assessments and then how to apply that. Okay. So what I want to do to bring this all together into how you can use this information now is start by understanding, feel it within yourself, just observe your clients, understand that ankle, subtalar joint, right? Ankle dorsiflexion, plantar flexion. Am I watching my clients squat and looking at the creases of their ankle? Okay. Am I noticing that maybe some of these clients who stand like the woman on the right, when they squat, they get these creases on the outside of their ankle? So just as a big takeaway, you know that that client is not squatting through their ankle. They're squatting around their ankle. That totally means that that joint is not lined up and they're at risk of arthritis in their ankle joint. Okay. Start to think about the interconnected movements of the subtalar joint: inversion, eversion, internal rotation, external rotation, dorsiflexion, plantar flexion. How do those all relate to each other? And then can you start without even understanding what it means? Maybe you don't understand what it means, but that's okay, because the first layer to understanding the foot is appreciation. Can we just appreciate through observation patterns of what we see, right? What happens when you just observe your clients going from bilateral, single leg, single heel raise, right? I'm just observing, right? I'm just curious, taking in information. Then once we start to see these patterns and we connect to that appreciation, you can start to add layers of meaning, right? And then when you understand that layer of meaning, then you add the layer of correction, right? Application. How do I recommend certain exercises to this foot type or to that foot type? And that is really everything that we go into through the entire EBFA library, through our barefoot training specialist. That should say level 1, not level 2. And really, I do encourage you to take in this information, just process it, appreciate it, start to apply it, and then build layers on top of that. Okay. If you have any questions, please let me know. Just type those in. I am going to just open that up. Hopefully that is okay, Dan. I don't know if Dan wanted to go over them. There are
That's fine. You can take a look. There's one in the Q&A.
Okay, perfect. There were some other more logistics things. When doing the one leg assessment, is the knee locked out or soft? So that is a very good question. So you want to have straight but not locked, right? So call that 5 degrees flexion in the knee. Okay. Now you don't want to be too bent, because it's not, that's kind of changing the gastrocsoleus complex. So by just simply 5 degree unlock, you're just allowing them to not hyperextend into those knees. Okay. But that was a very good question. Thank you for that. Any other questions?
There's got to be more questions. Come on.
I feel like sometimes it's just more like brain is like, and they just they need to process it, right? Okay, let's connect it, right?
Somebody's saying they would like to see a sample workout. So
the sample workout, if you're interested in workout and how I create, so programming is different than a workout, right? Because a programming is going to involve a progression of what are we mobilizing? What are we going to activate? How do we integrate this strength? That is part of what we do in the Barefoot Training Specialist. If you're looking at more a workout, then that would be the barefoot strong workout. And that is a course that FAI does host. There is a discount on that. Dan, what is that code again?
Boxing 33. I'll put that in the chat.
Yeah, so that gets you
all caps.
Yeah, and 33% off, right?
Yep, 33% off. Yep.
33%. Okay. So you get 33% off of that. And that, for the individual who asked that, that would be an actual workout that incorporates still, okay, let's all set our base. Let's activate our feet. Let's connect to our pelvic floor. And then let's start to build glute strength on top of that. Now, not everybody is going to get the same effect of that, because foot typing becomes very complex as you kind of dive into it, and you want to understand the subtleties of it. So hopefully that will work as an answer for that individual.
What Yasmin's asking, what's your opinion on toe spreaders / separators?
Oh, don't get me started on them. I love them. Dad knew I was going to say that.
She's got
I
some right
know.
there on her desk.
I do. How convenient is that, right? So yes, so actually through Naboso, we sell toe spacers called the Naboso Splay. Other brands, Correct Toes, Yoga Toes, any toe spacer on the market, awesome, great. The benefit of them is that it is stretching and trying to support forefoot alignment, which is important to how we push off. So it's a really good reset at the end of the day. Some people wear them in their shoes. Some people wear them when they work out. If you have bunions and hammer toes, they're really good. So yeah, I'm a fan. I'm a fan of toe spacers.
I want to ask a quick, you said wear them in your shoes. How do you fit those in your shoes if your shoes don't really allow for, say a wide toe box, right? If your shoe is...
Yes.
I mean,
So
I have found myself as I've gotten older wearing wider shoes and wanting to have more room for my toes. But every once in a while, some of my, shoes for playing basketball or running, they're, a little bit tighter. I don't think I could put a toe splay in there.
So yeah, so you do have to match the shoe to the spacer. That is where some people will want to do more like a minimal style shoe. So barefoot shoes
Sure.
are typically wider, or having wider shoes, like New Balance is historically wider, things like that. So you would just have to accommodate the spacer.
Okay. And then separate from shoes, like how long would you be wearing them? I mean, are you sitting around in your office wearing them for 15 minutes? You doing them for 10 minutes at night? Do you sleep in them? I mean, like, assume I know nothing about them. Like, how often do I use them?
Yeah. So we tell people to start with 30 minutes a day. I would suggest at the end of the day or at home, right? You could be sitting on the couch, you could be reading, you could be doing whatever you want to do, but start with 30 minutes, see how it feels, take them off. And then you're essentially doing that again until you feel, okay, this is more comfortable. I'm totally fine wearing these for 5 hours. Many people wear them all day. I personally wear them 30 minutes at night, and then like I'm good. And then I go to something else, and I would rather wear like our socks. So I'll do them for 30 minutes and then I wear the Naboso socks, but everyone has their own comfort level. If you can get at least 30 minutes of that, that's what we strive for.
Okay, great. Now the questions are just streaming in. So Myrna says, how do you assess someone who has had a dancer's fracture, meaning their small digit will stick out?
So a dancer's fracture, hopefully she's referencing the same thing, is a fifth met fracture is what a dancer's fracture is. And it just typically has to do with how they land in a plantar flex position. And then it can injure, where's my skeleton? The fifth assessment would be exactly the same, right? Any fracture in the foot, assessment is the same. If they've had a fusion of any bone or joint in the foot, same way, both feet, one leg, heel raise, and then start to determine from that.
Okay. What are your thoughts on barefoot shoes for someone who has chronic plantar fasciitis?
Look at your foot type, look at your foot strength, and look at your foot recovery. If you have an unlocked, unstable foot, do you have the foot strength to support the increased stress of a minimal shoe? Hopefully. And then are you increasing your foot recovery to offset the increased stress from minimal shoes? If you don't have the strength and you're not incorporating the recovery and you start to feel foot pain, then you know what you need to do. You need to increase your strength or you need to increase your recovery. So I try to make it very simplistic in that sense versus just blindly saying, yes, it's good. No, it's not good. Right? Is just think of those three things.
Okay. Susan asks, how do you handle situations when someone can't do a single leg heel raise without support?
So then functionally, what that means to me, right? So some of these are all awesome questions, but there's gaps in knowledge for me to fully answer that, right? And I could answer it, and then half of you might say like, okay, that I don't know how to use that answer, right?
Sure.
But when you're doing a single heel raise, the muscle that I said you're testing is the posterior tibialis. If someone cannot do that, then they have a dysfunction, weakness, or tear in the posterior tibialis. Now, you're not treating that, like you're not diagnosing that, right? But functionally, as movement specialists, we would say, well, we have to be able to do that, because how do you get upstairs? How do you go downstairs? How do you walk? How do you push off? How do you jump? If I can't do a single heel raise, functionally, I am compensating every single time I take a step.
Mm-hmm.
Just leave it at that. That's what I want you to take from this, and then say, okay, I need to understand how to help that client if I'm seeing that, right? And that's a big part of what we go into the trainings is, how do you do that? Why is that important? And why is that client getting transfer stress? Well, I'm not surprised they're getting transfer stress. They don't know how to achieve what's called a rigid lever position. And that is a necessary position for optimal function, right? It could also put them at a fall risk, because I know that that's a concern, right? With kind of functional aging, is if I can't do a proper single heel raise, I'm going to change the way that I walk. And
Yep.
that change will increase my fall risk.
And the way you go up and down stairs would have to dramatically change, which would
100%.
not only be a fall risk, but a dangerous fall risk, right? Like going up and down stairs
Extra
becomes
fall
a
risk. Yes.
literally a deadly task you're doing if you're
Yeah.
compensating, right?
Yep.
All right, we'll do one or two more questions. Let's see here. Allison, for someone with severe rheumatoid arthritis who needs orthotics with a doctor involved to walk without getting sores, would I still do an evaluation with orthotics in, or do we assume the orthotics address everything?
I think that even if someone wears orthotics, for the clientele, for all of your clientele, you still want to understand what is their baseline foot posture and how do they move through it, right? So, Allison, if you're training that client in their orthotics, in their shoes, and not doing any barefoot training because of either their or your decision or for medical reasons, right? We'll just kind of leave that there. You still want to understand what you're dealing with in the shoe, because it helps you with the cueing. You can still train that foot to be more engaged. You can engage those digits into the pelvic floor. So I do a barefoot closed chain assessment on every single individual. And I would encourage you to do the same.
S. Grogan is asking, my clients are seniors with good to poor mobility, so that sounds like a big range there. Does this training address this population? And I would add to that, Emily, which of these trainings do you think would be most applicable for those working with seniors?
Ooh, neurosensory. Dan, we need to talk about getting that on FAI. And then the barefoot strong, like the workout is very good because it's a further intro to what we're talking about. I did assessment today, but it goes into the anatomy, it goes into the correctives, it gives you 3 variations of a workout, how to cue, how to do breath, pelvic floor. So that's an awesome one. I would totally do that one as a layer 1. And then the neurosensory adds in visual, vestibular, proprioceptive, mechanoceptive, and it ties in a lot of the Naboso products. And then there are a couple other ones on FAI. There's a feet fascia functional movement. Pelvic balance is great because it's centered around pelvic floor, glutes, anterior pubic joints. And then movement disorders, mastering movement disorders is another one that FAI hosts, which is really good. And the price point is really good on those courses.
Yep. Great. And we'll send a follow-up for those of you listening on the recording. You've already gotten the follow-up where you can get links to some of those courses. All right, last question, then we'll let you go. Claire asks, I have clients who tell me they cannot do heel lifts due to pinned big toes from bunion surgery. Any suggestions?
Aha, love the question, because there is a difference between having a pin from bunion surgery where the pin is in the metatarsal from a fusion of the big toe joint. So you want to differentiate that, okay? If they corrected the bunion in the metatarsals, and just I'm moving the toe out of the way, just the long bone here, and say there's a screw going across, 100% heel raise, single heel raise, push that foot as much as you can. That foot is stable, okay? If they have a fusion of the big toe joint, which you would be able to tell, open chain, just grab their foot and try to move their big toe. And if their big toe moves open chain, you're just sitting here and you're like, oh, it moves. I would push them on that single heel raise for the reason that we discussed, that Dan and I were saying, of this fall risk of how they're going down the stairs. So if there's a misunderstanding of that client of the screw in the foot and they're concerned because they don't understand kind of what that means, then they might actually be moving more gingerly and cautiously than they actually need to. And that fear or hesitation is such a contributor to falls as well, that I want them to have full confidence in that position of their foot so they can take those steps in the way that they need to.
Yeah, when I saw that question, and I'm certainly not a foot expert, I was like, are they actually pinning big toes so that you can't do a heel lift and get up on your toes? I would not want that bunion surgery, because
Yeah,
that would definitely lead to falls. I mean, that if you can't get up on your toe.
yes.
Are there
But
bunion
but that is
surgeries
the
like
case.
that where they literally pin and fuse the toe to the metatarsal?
Yes, so that is a hallux rigidus surgery.
Oh,
Very different than a bunion. And that you would know based off of, you would take the toe and you'd be like,
yeah.
there's no movement. You'll know if a toe is fused, and there's usually a plate that's put across, or a screw, like 2 screws will cross the joint. But I mean, there's like no movement. If you're like, oh yeah, I got some movement, not a lot, the joint's not fused.
Yeah. Okay. All right. Well, we're going to let you go. Thanks so much for your time. Again, for those of you on live, Emily will be at the Functional Aging Summit in June, and she'll be doing a full half-day workshop the day before, in addition to sessions at the conference. So that's something you definitely want to get on your calendar for next year. You can go to her website, ebfaglobal.com, to learn more, or naboso.com to learn about the splay and the Naboso socks and some of those other cool products. My wife is a huge fan of the socks for recovery. So lots of cool stuff there. And then we'll send out a follow-up email where you can get links and coupons to some of the courses that we carry. So thanks again, Emily, for your time today.
Thank you, everyone.
Thanks everyone for being on live.
Take care.
Bye-bye.